Hello, everybody. Welcome back to another episode of Into the Wild. In today's episode, we will be shifting gears to discuss an equally important topic, which is mental health in the medical and veterinary professions. And I'm joined by a physician who's currently completing his residency, and is also a very well-known voice on Instagram for mental health education. And we're going to be talking about exploring burnout, stigma, as well as how we can support people in the medical and veterinary field.
Thank you for having me. Thank you for having me.
So we're just going to jump right into our interview. So some of the questions and topics we have are, the first one I'm going to start off with is, what makes healthcare professionals uniquely vulnerable to the mental health challenges that we face?
Yeah, I can kind of jump in. And again, I'm Devin for anyone watching, I guess. I'm a second year psychiatry resident at UC Irvine Hospital in Orange County. And then I also do content creation, as Amrita mentioned. And then I also have a background before the content creation in like filmmaking, which I'll talk about in a bit. But regarding mental health workers and being vulnerable to challenges themselves, so, if you work in the mental health space, whether you're a therapist, psychologist, psychiatrist, social worker, anyone in that space, you'll be hearing these struggles of others, of strangers, of people that you may have met a couple of times, repeatedly. If you go into work like an 8 to 5 shift, you'll every 30 minutes you might have a new patient, and you're working through some sort of emotional stressors, some sort of mental health stressors, some sort of mental health condition, be that schizophrenia, be that bipolar disorder, be that depression, be that a personality disorder. And the weight of hearing all of that combined with whatever you've got going on in your internal, like your private personal life, can sometimes be a lot. Helping people to deal with their stresses, their triggers, their traumas, it's natural that some of that can bleed onto you as well. So it's learning the practice of being able to help someone through their challenges and remain objective in the sense that you see yourself as a provider, not as, just like their friend who's just there to provide um, subjective emotional support. Rather, you're there to provide more objective, like a healthy mindfulness-based, like evidence-based, medicine-based support, right? So it can be difficult to not let that bleed through and affect your own life. But I think every physician, every person in that space has their own kind of strategy for how they manage that. And I think when you start working in the space, um, it may take a little bit of time to figure that out, but for me, I can just kind of speak about it. I try to, when you're with a patient, when you're with someone going through that, when you're talking through those things, you need to be there fully present and fully involved in that, in supporting them and listening to them and understanding what's going on. But at the same time, you kind of have to restrain the emotional side where, you may want to act in a role that'd be outside of being a provider. So the way that you do that requires you managing your own mental health, right? So you
Mhm.
don't feel like you are overly burdening yourself to a point where you feel like your own emotional reserve is drained and
Yeah.
you are kind of privy to, you know, not being able to keep the sense of objectivity you normally would. And I'm kind of rambling about this, but it's a very it's a personal everyone comes at it a different way. And
Hmm.
I think it's the main thing is always being aware that it's possible that, you're experiencing some transference, or you could be, when you're speaking with a patient, sometimes your own biases, your own personal
Yeah.
things come out, and always being aware that that's a possibility and that nobody is above that happening. Is kind of the starting point. The specific things that you do to maintain your own mental well-being while working in that space and helping people with their own respective mental well-beings is it's different for each person, but you
Hmm.
need to always remember that you're always learning and you always need to um, kind of check yourself in that space. And I can speak a little bit more specifically about it, or where would you want to kind of jump in with that?
I was wondering if you could delve more into delving about how we can. So, from my understanding, there seems to be like a fine line between giving somebody that proper healthcare that they need
Yeah.
versus getting emotionally involved. And as humans, sometimes we tend to get emotionally involved. And I was wondering if you could talk about how we can
Yes.
walk that fine line.
Right, right. Okay, so now thank you. That was really good guidance. So it's basically like when someone comes to you with mental health, any kind of mental health condition, sometimes the patient may want to be there and sometimes they may involuntarily be there, involuntarily
Yeah.
be receiving treatment. So now if they want to be there, they may be more bought in. Bought in is kind of the idea that they are agreeing that they are a patient, that they are in need of help, and that they need to listen to, the provider, whoever's trying to help them. That's one side of it. The other side of it is someone who does not want to be a part of
Mhm.
that process. They don't want the treatment, right? So with either of these patients, you need to be careful in the sense that you may hear of the things they're going through and think, oh man, this is really hard. They're really struggling. Let me not be so strict on them. Let me not do what evidence-based medicine would guide me and tell me to
Yes.
do. Let me instead do what feels good.
Hmm.
And maybe they'll smile at that and they'll frown at the evidence-based medicine if you were to
Yeah.
proceed that way. One of the challenges that you learn to overcome in residency and in training in any medical field, regardless of your role or position it's that you learn the evidence-based medicine is what always kind of takes like the prize position, right?
Hmm.
Doing what feels good isn't necessarily what's always indicated, right? It may be
Yes.
contraindicated to do what feels like the friendly thing to support somebody. Um, you know, Giving someone who's manic, who has bipolar disorder and is going through mania, they may not want to take medication,
Hmm.
but as a physician, as a provider, that that's what's indicated, that's what's necessary for their own well-being. And sometimes you have to, encourage them to take that, take medication even though they don't want to, and you have to kind of be their enemy as they might see you, and you have to be okay with that. You have to be okay with them not liking you.
Yeah.
In your efforts to give them care,
Hmm.
because sometimes they're not, on the same page in that setting. Usually, when in the mental health space, when you give care to someone, whether they are agreeable to it or they're not on the same side as you in the way you see things, eventually, once they're kind of back to their baseline, they'll be able to look back on it and be like, they may not say thank you, but they will be able to, once their insight is restored and their capacity and their judgment's restored, they'll be able to see that, you made the right decision, and you don't need to always live in fear of like, oh, did I do the wrong thing? In that setting. And when I say did you do the wrong thing, I mean because you might feel bad because you do something, you make a medical decision that they
Yeah.
don't like, right?
Yes.
So it's learning to let go of the fear of being liked is like the main thing.
Yeah.
And then to speak to the earlier question, learning to be okay with that and to continue practicing that is how you avoid, you know, going through other folks' mental health struggles and their traumas and all that, to avoid that bleeding into your life and making your own mental health, suffer or
Mhm.
struggle a little bit. You have to just be always be cognizant of that. And you need to know, at the root of it, you're there to provide care. You're not
Mhm.
necessarily there to be liked.
Exactly. And I feel
Yeah,
like in vet med, that's more strong than ever because sometimes owners will come in and we will be giving them like proper, what's the word for it? Treatment for their pet. And sometimes
right.
there's not an option. And sometimes you do have to euthanize the poor animal for quality of life reasons, etc. And the owner sometimes doesn't like hearing that, but
Of
it is
course.
what's best for their pet. And at the end of the day, you still have to do that. And I feel like a lot of veterinarians and me as a vet assistant, we struggle with the fact that, oh no, this owner's sitting in like my patient room crying.
Hmm.
Um, I don't want to tell them that this is what their pet needs, but I have to. And I think sometimes going back home, I cry sometimes. And I
Oh
think
man.
just dealing with that emotional struggle is very difficult. And yeah, I actually really liked what you said about
And
not
to
getting
kind of
emotionally involved.
And to kind of jump off what you were saying, so in that setting, a pet owner comes in and let's say their dog is suffering something that's really debilitating towards their quality of life,
Hmm.
and you would, as the provider, recommend like euthanasia, like putting down the pet. In that setting, you're saying that sometimes owners will be like, never mind this, I let me take them back home,
Yeah.
because they're so emotionally attached that they can't necessarily think about the suffering that their pet might be
Exactly.
going through. They think more about their own bond, and no, 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 I need to be with them. That can be really difficult. And, animals can't verbally communicate. I mean,
Yeah.
unless they're parrots, and I know parrots are just repeating things, but
Repeating things.
right. But like whatever they hear. But I'm not the most familiar, so I might be wrong. But yeah, so I think that's a very challenging space, right? Because there's no verbal communication with
Mhm.
animals, right? So you're using, and I wouldn't at all be familiar, but I know you are, with the signs that would they use to show that they're going through pain and that sort of
Yeah.
a thing. And you're working with multiple patients, right? The pet and the
The
parents, so to
client
speak, of
is
the the
the
client,
biggest patient,
the
technically.
right, and you're kind of treating, multiple individuals in
Hmm.
different ways. So I can only imagine how challenging that would be, and that's, big respect to working in that space. I think that's awesome, and I think it comes with its own uh, set of challenges, I'm sure.
Yes, it does. And I think human medicine, medical people working in the human medical space and
Mhm.
veterinarians could honestly work together because there are cases where sometimes the owner does in fact take their pet back home. And
Mhm.
sometimes at the end of the day, the vet can only do what the owner wants. They want what the owner wants done to their animal in most
Right.
cases. I can't force an owner to do something if they don't like sign off on it or they don't pay for it. And I think that aspect is also difficult because letting go of, oh, this client didn't want me to do this to their pet, but I know that this dog or this cat would feel better.
Mhm.
And I feel like veterinarians and vet assistants sometimes feel guilty that they're not doing enough to alleviate this pet's pain and that this owner is like unaware of what they're inadvertently doing to their animal. Yeah.
And usually, how do you grapple with that? Is it just educating like the client, so to speak, as much as you
Yes.
can, or
Sometimes the vets I know will send home some literature that the owners can read,
Mhm.
educating the client, and sometimes you just have to let go. Like you can't, sometimes you just can't do anything. Um,
Okay,
yeah,
that's tough. Yeah.
yeah. Which also brings me to the next topic, which is the role of responsibility and perfectionism, along with long hours and emotional labor. So, how can we in the healthcare setting be more realistic with veterinary and medical students that are entering the field regarding these? Because as a child, so I didn't grow up with any pets, and I'm Indian, and a lot of my family is doctors. And
Yeah.
when I said I wanted to be a vet, it was like, what? Who treats dogs and cats? Kind of a thing. And I think when I first became a vet assistant, it was kind of glorified to me. Oh my God, like it's so cool to get to play with dogs and cats all day. And then as I got to work at, various hospitals, it really opened my eyes to the stuff that you see. So how can we be more realistic and less glorify-y about both careers?
And meaning like working in the vet space, working in the mental health space, how can we be realistic for like young people who want to get into that
Yes,
space?
exactly.
Right. So I think it's and you touched on this well, like sometimes you see one aspect of a career, right? And it kind of glorifies it in your
Yeah.
mind. You're like, oh, this one aspect of mental health care, it looks really cool. This one aspect of veterinary medicine looks really cool. And you
Hmm.
might be drawn to it for that reason. And when you're young, those are the sorts of things that pull you, right? Most of the things when you're younger are like emotional pulls. Like I really like this thing, I want to do this,
Yeah.
or I really don't like this career, so I'll avoid that. So I think it's fine to let your passion guide you, but as you get closer to to medical school or vet school or those sorts of things, always try to get experiences, like
Yes.
even shadowing experience, just to see the full process. Because like in mental health, there's clinic, there's inpatient in the hospital, there's like partial hospitalization programs. There's lots of different things that you can work in and that you will work through as like a resident, as a trainee. And then in the vet space, I'm sure there's also a lot of different types of settings you can work in.
Hmm.
Sometimes when you're young, and I can speak for myself, like I had like no clue what was going on, right? I thought of psychiatry. I thought, okay, it's like you talk to someone, get to know their story, and then you help them in some way, and that's the main
Yeah.
driver towards it, and that's true, but there's more to it.
Hmm.
And with in the veterinary space, I'm sure that you mentioned the things that kind of pulled you towards it, and I'm sure as being a vet assistant and going towards vet school, you've learned about a lot more aspects than what initially drew
Yes.
you to it, right? And in that process, you discover if your passion is as strong as you thought it was, because sometimes you may be dissuaded, and there's nothing wrong with that.
Hmm.
When you see the full, the aspect of what it might entail. But or sometimes you see that there's new challenges and there's things you didn't expect, but it makes
Exactly.
you desire to be in that space more and desire to serve society in that way more. And I think young people, when you're young, there's so much noise, right? There's family, there's friends telling you
Yeah.
should do this, don't do this. There's stigmas around, oh, why would you do this career? Much of our family does this. Why don't you do this instead of
Exactly.
this? There's a lot of that. So I think that the first step is, try to put aside the noise and just really think about what it is you like, right? That should be
Mhm.
the first step. And then once you've decided that, right, regardless of anyone's opinion, what it is you enjoy doing, and hopefully it's some sort of thing that can serve society, be that veterinary medicine, mental health medicine, any career, engineering, food service, artistry, whatever. You should just first feel, do you really have a passion for this? And then once you've decided that you have that, you should go explore that field as much as you can. And then in doing that, you'll see all of the aspects of it, not just the like the ones that look really pretty and idealized. You'll see what the full process of doing whatever that career is. And then if you still like it, then I think you should just pursue it fully. And you have to just learn on that process. All young people just have to learn to be okay with not everybody liking what you're doing. In the
Hmm.
same way, in the beginning, when we talked about in the career itself, sometimes your patients don't like what you're
Yeah.
doing. Sometimes your clients or the pet owners don't like what you're doing, but you know that in that space, in evidence-based medicine or veterinary-based medicine, I kind of made up that word, but in either of those spaces, you know what the protocol is of what would save this animal from, a lower like quality of life or a
Yeah.
lower or like a further disease progression or whatever it might be. And in mental health, the same thing, right? You know that you could do these things that are easy, you can do the thing that's harder. And in the same way that you have to kind of use your brain and not let certain things affect you there, even in the even in pursuing the career itself, you have to learn, and it's a hard process, to not let any stigmas around it or any like family influence dissuade you from doing something that you know that you could be good at and that you really enjoy, right? Because
Hmm.
at the end of the day, for all the young people, it is your life, even though
Yeah.
you grow up and you kind of, for a lot of people, you just listen to everything your parents say, you do what they say. But then at some point it does become your life, right? Like you're the one who has to live that life for the rest of however long your life is. So you can do what family or society tells you and makes society or your family smile, but that's not going to be like a long-term thing. It may feel good in the short term, but eventually you're going to come face to face with the fact that this is your life and you have to live it. So that's why it's good to work towards building the courage to pursue the thing that you like, regardless of what anyone thinks about it. If whatever career you choose, you're able to serve society in some sort of way and give service to others, be that through medicine, through food service, through artistry, through whatever it is you're doing, then I think that's like a noble thing. Anything where you get to serve somebody and help their life in some way, regardless of what aspect that is a
Hmm.
great thing to do, and it just contributes, right? I feel like being able to contribute is a feeling that will always, even if you don't have a lot of money, it'll
Exactly.
still make you feel good inside, and then you can work and figure out the money parts. You can also have an externally comfortable life and have a place to sleep and food to eat and all that stuff. But I think that's kind of what it takes. So it's a step-by-step thing, and it really requires listening to like your heart and listening to what it is you truly like and putting aside the noise of stigma of what other people tell you and that sort of a thing. And being able to do that will guide you in the career itself, because you'll deal with that again at every stage of
Yeah.
life, like the noise of what others think.
That is true. A lot of people will have opinions about anything that you do, and I think
Yeah,
as we get older, learning how to like turn off the noise is really important.
definitely.
Thank you.
Yeah.
So my next question, or more like topic, was euthanasia and compassion fatigue in veterinary medicine. I don't know if people know this, but veterinarians have the highest suicide rate in the United States because of compassion fatigue, along with factors such as working really long hours and student debt.
Mhm.
And I was just wondering if you had any thoughts or advice to people who are entering the field, or if you've ever worked with a veterinarian, if you're allowed to share that, I don't know.
I've not worked with a veterinarian, but I think the field is very interesting, and it makes sense that you would go through a lot of emotional stressors. It's very sad to hear that the high suicide rate is with this profession. I think it's an honor to serve in that profession. You get to help a lot of animals that
Hmm.
truly don't have a voice. But I think with any career, I think the ways to safeguard against getting to a really dark place is to every day check in with yourself, because sometimes when you're doing the same job every day, you can kind of go on autopilot and you just forget about your sometimes your physical well-being, but sometimes also your mental well-being. And you kind of just keep trudging through it, thinking that, eventually I'll take a break.
Yes.
It's good to take some time every day to have sort of that mental break, so to speak, where you're able to just think about, reflect with what your emotions are, right? Don't ignore how you're feeling, because it can build up and come out in a much worse way. If you ignore the fact that you're becoming depressed, when you accept it, it may be much harder to deal with, and you may be at a much lower space.
Hmm.
If you need help, you should reach out for that. And I think sometimes in training, is medical training, veterinary training, sometimes a lot is expected out of you, and there's not necessarily the resources and the support to take breaks. And if you take these breaks, you sometimes feel selfish or you feel
Yeah,
lazy, because the curriculum is designed to make you just be almost like a machine. And I
exactly.
think in also learning to silence the noise of what others think, you should also learn to speak up when you feel you need time or space or a break from something. I think a lot of these careers train you to never need time, never need space, never need anything. But at the end of the day, we're all humans as well. We need to know when to reach out for help and when to say, hey, like I need a break, I need a pause.
Hmm.
Because to experience compassion fatigue or to experience burnout or any of these things, it's a long process of many, many days of not getting help that build up, build up, build up, and then it really hits you. So if every day we're able to just reflect a little bit, and when we identify some kind of emotional stressor, struggle going on within us or externally outside of us, be it a colleague or someone, being able to stop and reach out to that person or check in on our own selves just so we know what's going on and we can kind of take the steps as we're going, not, oh, something bad's happening, let me address it in months, right?
Yeah.
That's never the right solution. Even though the days can sometimes feel so busy, you're like, I just don't have time. You do have time, right? Like the
Hmm.
main priority, if you're not well inside, you're not gonna be able to make others well outside of you, be that
Exactly.
the
Yeah.
animals you're working with the patient, right? Exactly. But yeah, that would be my take on it.
So you're saying setting a perfect balance between like work and yourself or school and yourself is what's important.
Right. So setting that balance, and there is no perfect balance. You'll always be learning like what's right for you, but just the first step is just knowing to acknowledge that when inside you feel the fatigue setting on, when you feel depression setting on, when you feel really down, when you just need an emotional break, is recognizing that. And then the second step is reaching out for help or
Hmm.
even reaching out to let people know you're going through this
Yeah.
and that you need some time to get through this because it's a very normal human thing, regardless of how curriculums may make you feel like, oh,
Yeah.
you should need this, you shouldn't need this, or it's a sign of weakness. It's not any of those things. It's a very normal thing, and I think we can all do more work to normalize that, so people
Hmm.
who struggle don't have to do it in silence and just kind of power through it.
My second question, which I didn't put
Yeah.
on for topics, which is kind of following up on what you just mentioned, is so our
Mhm.
society kind of puts a stigma on people, especially this guilty stigma, like you just mentioned, on students or veterinarians or doctors, to
Mhm.
again take breaks or reach out for help. And some people don't believe in mental health or empathy or compassion or that kind of thing. So how do we talk to people? What is the proper way of communicating to these people who
The
don't
main,
yeah.
yeah. Right. No, that's a great question. The main thing is communicating that, we all is perspective, is communicating
Mhm.
perspective in the sense that a lot of people who look down or talk down on those
Yes,
who need this time or space, they may, if they're not of the same generation, they may say, well, in our time, we
exactly.
didn't need these things. We didn't
Hmm.
need this space. We were stronger. We were tougher. We would just get through it. But, they can state that, and that's maybe true to their experience that they
Yes.
had in the time they grew up in, but they've never lived the same life that someone else has lived, and so they don't know the full picture and the story and the stressors and the struggles that maybe they don't even necessarily have to be younger, but just that other generations are going through. You can only really speak to your own experience. You know what
Yeah.
I mean? Like in the same way that if I've lived a male, I'm an Indian American's life, right? I can't
Yeah.
really speak to having lived a female European and who lives in Amsterdam's life, right? Like I can't speak to that experience because I've not
Hmm.
lived it. So in that same way, I can only observe those things from the outside. In the same way, it's very hard for people to really understand what another one's going through. And I think it's important that, if you find yourself in that space, it may be natural to get really angry and get defensive.
Yes.
The better thing to do is just to try to communicate and just explain that, the try to give the other person perspective in the sense that they may not know the full picture of what's going on in your
Yes.
life. So if you're in a space where you need basically a break, where you need mental health resources, or you need support, where you need to slow down, the best thing you can do is just communicate to that person without getting defensive or getting on the offense, is just trying to communicate your experience to them, which is one of the hardest things to do. That's why there's so much like hate in the world, because people struggle to understand another's
Yeah,
perspective, so they'd rather
exactly.
just hate a group than understand what makes them act in a way that makes me feel so uncomfortable.
Hmm.
So that's the main thing, and there's no easy answer for that, but it's giving perspective in any way that feels normal for you. Usually best done like through a conversation. And some people still may not understand when you need help. And in that space, if you find yourself in a setting where, you're just being treated unfairly or poorly, and there's just no space for you to grow and to do well, then sometimes it may even be necessary to leave that space and
Yeah.
find somewhere else you can go to do your training or do your work. Because, the first thing is your own safety, your own well-being. You can't help others. You can't really serve society if you're being plagued yourself.
Hmm.
Yeah.
And then my other question was, how do factors like debt and emotional labor and client expectations contribute? I'm pretty sure maybe you've met clients who are like, I need a quick fix for like my depression or something like that. So
Yeah.
how do you talk to them about the reality of what they're going through?
Right. Of like a patient who comes in and says they need a quick fix for like whatever they're going through.
Yes.
Right. So I think the idea of quick fix, so that's interesting. So in American society and most societies throughout the world, I'd say sometimes people are who believe mental health or like getting, therapy, those sorts of things is like bad or is weak. They may
Yes.
turn to other vices to relieve whatever's going on inside them. If they're very depressed, if they're very anxious, if they're going through something, something
Hmm.
difficult, they may turn to quick fixes such as like substances, right?
Yes.
Drugs, alcohol, those sorts of things.
Hmm.
And that's not to put any stigma on folks who use that. We all go through difficult things. Some people turn to those sorts of things. But as a medical provider, our job is to educate that in the short term, maybe drinking alcohol makes you feel better, but in the long term, it's not good for you. There's if you do meet criteria for a mental health condition and you need medication or you need some sort of like pharmaceutical thing to help you through that, there are indicated medications for whatever it is you might be going through. And though those don't act in the same way like a quick hitting like drug or alcohol or something might, they work in such a way that most of these work in such a way that without just giving you an immediate relief, they help you over the long term, right? They help you to get through depression. They help you to, if you're experiencing mania and you're bipolar, they help to get you out of that. And it takes time. So if someone comes to you asking for a quick fix, the first step is educating that,
Yes.
there's not necessarily a quick fix for every like medical condition or whatever you might be going through, but just getting them to understand that is kind of getting them to buy in, as I kind of mentioned earlier, into wanting to work with you against whatever disease they're facing, right? As
Mhm.
opposed to you, the provider, and the client or the patient working against you, right? Then it's like everyone's splitting teams and it's very difficult. So the first step is just educating. Once people understand things fully and can even explain it back themselves, not all of it, but a lot of stigma, a lot of the internal quick judgments they had get reduced. And through the power of like education, through the power of genuine knowledge, a lot of that goes away. Not all of it. But that's the first step is just educating and explaining and just making sure people understand what it is they're talking about.
Awesome. And
Yeah.
again, how do factors like debt, I also wanted to talk about student
Right.
loans.
And right, when you mentioned debt, in terms of like, so we kind of discussed like client expectations. Now, debt in the sense of like becoming like a doctor, like the student
Mhm.
debt.
Yes,
Right.
student debt. Yes.
Yes. So this kind of trails back to one of your earlier questions where it's like, how do you choose what career you want to pursue, that sort of thing? Because, whatever career you choose nowadays, you're gonna have to pay a lot of money to become the thing, right? In order to become a veterinarian, you're gonna have to go to school. That's expensive. Before that, you're gonna have applications and exams,
That's
which
so
are
true.
expensive. Right, right. And when you're training as a student, you may even pay for parking. You may have to, I'm sure you have to pay for your food every day. There's a lot of money that it takes to get this degree and to become this thing. If you want to go to med school, you first pay for college, then you pay for medical school, you take out loans, there's interest on them. There's that whole thing. And then you go into residency where, you're not paid the full wage salary that you normally
Yeah.
would make as that profession. You're kind of paid a trainee rate. And then plus you've got your debts, you've got, your own cost of living you have to pay for. Most hospitals charge for parking. There's all a bunch of little costs that add up. Your licensure, your all the exams you take. So, that's why it's important. I think before you jump into a career, really take the time and make sure that it's true to like your soul and true to what you want to do. That, you need to really think like, am I doing this because somebody else is going to be happy that I'm doing it, or am I doing it for myself? And
Hmm.
if you're doing it right, and if you're doing it for yourself, then it's easier to accept that, I'm gonna have to pay a lot of money for this. I'm going to be working for a long time without any real salary if you're in a trainee position. And then you're better able to accept that because you're doing the thing that that your heart really craves and wants to do. And in those settings, if you do find yourself really low on funds and you don't have the support of family and there are programs, and of course, it's important at these points to reach out for resources and support.
Yeah.
And it can be very difficult to be a student. But so the main thing is whatever you're a student for, make sure you actually want to be doing that before you accumulate a lot
Mhm.
of debt, use a lot of resources to do something that you didn't really want to do in the first place. Yeah.
And again, from your experiences, how does social media help our society battle these issues?
Right. So the thing with social media is it's pretty much the majority of people, I can't speak for everybody, I see whenever they have free time, they're on like a lunch break, they're, just gonna go sit on the couch, go on their phone, they watch like, videos, would be that TikTok or Facebook or Instagram or
Hmm.
X or any of these platforms. There's so much content online. There's so many things you can watch. A lot of news is released as like content bits
Yeah.
nowadays. Everyone's eyes are kind of on content. So if everyone's eyes are there, it naturally can be a place that can be used for kind of brain rot, as so to speak, just like
Hmm.
mindless entertainment. Or you can try to put out a positive message, and these messages can be anything from reducing stigma towards educating people to explaining like how to fix things in your home. Right? It seems every profession there's a subset of like influencers in that
Yeah.
space who speak about it. If you're a plumber, I'm sure there's plumbing influencers who
Yeah.
speak on, hey, if you have this issue in your home, this is how you fix it. And there's a
Mhm.
lot of really good ways that every profession can contribute to the big massive amount of
Yeah.
content being consumed by putting useful knowledge into it, by putting anti-stigma talks out into the world. Because if you go into the comment section in any video, you'll see a lot of people spreading like hate and
Hmm.
negativity, regardless of the topic. And it may just be, as we mentioned earlier, misinformation or miseducation or lack of education on their part. So that's why it's good to just put a lot of education out into the world,
Hmm.
and that will hopefully help people. That will hopefully help to slowly move society forwards by correcting a lot of the misinformation out there, especially like just some examples during the time of COVID. If you go back in
Hmm.
American history during the time of like the AIDS epidemic, right, in like the late 80s, early 90s, there was no social media then. But if there was, there could have been a lot of good
Oh, yeah.
information released that way. In those times, the media forms were like, TV, movies, newspapers, those sorts of things. And Hollywood made a lot of good films about AIDS that kind
Yes.
of combated a lot of the
Hmm.
misinformation out there. And as I mentioned earlier, my initial interest was film, and then in med school I started doing content creation because I didn't have as much time to explore like filmmaking and making
Hmm.
short films. So I started doing content creation. But historically, America has made a lot of good movies that kind of tackled a lot of the different
Yeah.
topics that came up in society. The AIDS epidemic being one of them. But yeah, so that's kind of the position I think like social media can play is if you get on social media to spread important knowledge about like veterinary medicine or mental health education or those sorts of things, or just if you're like a cardiologist, just heart healthy things like these are the foods that you should eat that are cardioprotective. These are
Yeah.
the ways you should exercise. Those sorts of things can be very valuable to people, and if people's attention is going to be on their phone watching content for like an hour or two a day, then by putting out like positive
Hmm.
content with like positivity, but also like a message, like some sort of education or that sort of thing, can be very valuable. So if you make videos trying to break like a mental health stigma, that can be valuable, and you're kind of pushing towards, an idea that hopefully progresses society rather than just pulls it back or slows it where it's at. And there's enough content like that out there that's doing that. So I think it's good, and it's imperative that, some people in every field, regardless of whatever you do, should try to put some good knowledge out there. And I think
Hmm.
that can just contribute to society going the way it should, which is progress.
And coming back to your like
Yeah.
Instagram presence, since a lot of people follow you, I was just wondering, how did you get the idea to involve your dad in a lot of the videos?
Right, right. So this was around 2022. I was studying for step one at that time. So
Hmm.
step one is like one of the big medical school exams. You take it before your third year, I think. You take it in med school. So it's like three steps. So step one, step two, step three. So I
Hmm.
was studying for step one. It's a very lots of knowledge is required for this, lots of practice tests. So I was kind of just living at home. I moved out of the med school apartment I was living in, just kind of studying every day. And I'd been making content before that. And then I didn't really have time to go meet with the usual collaborators that I would go to like Los Angeles to record with, like actors, actresses, those sorts of things. So I was just at home. And then my dad was at home too. So then, I asked him if he would be interested in, being in like the content, and he was like happy to do it. It's just like a fun activity. And then we made like a bunch. Like some of the first ones were like, when you're like dad, when you have like a healthcare parent or like a
Yeah.
doctor parent, and like they give you advice. So, we made some of those, and then they were relatable. People seemed to enjoy them. So then we just continued doing it. And it became like a good way to discuss like issues that, men
Hmm.
face or people face with their parents. But then it also became just a good, just like internally, personally, it was just good activity for like me and my dad to do, my dad and I to do, because it's just fun to, come up with an idea. You write the script, and then, um, basically show it to my dad, kind of explain the idea, and then kind of help him to record it. Both of us help each other to record it, and then it just became a good activity. But I think on the larger scale, I think it's good to in social media in that space have people of different generations like present on there. So my dad's of a different generation, I'm of a different generation.
Yes. Yes.
And you can use that to have conversations or inspire others to have conversations with their own loved ones that may be beneficial in their own lives, right? Because anything anyone watches, they're not necessarily watching it for me or my dad. They're more so they're watching it because the way that it makes them feel, it
Yeah.
allows them to put their own emotions into
Mhm.
that space, and it tells them something about themselves, right? So it's more about the viewer. Um, and and I think the ability to do that, to make others think, is what my dad and I enjoy, and that's kind of why we continue to do it. Um, yeah,
Yeah, I completely agree with that because I feel like my parents, my mom, who's also on Instagram, she also watches these videos, and I
yeah,
think she's also of a similar generation. She's not my generation, obviously, and I think seeing your dad, she can kind of see herself, and it kind of puts things into perspective. And I think she and a lot of other adults are able to understand truly what it is to be like the parent of a person who's in a healthcare profession. So yeah, and I'm really grateful to that. And it's also some really good South Asian representation. So yeah.
Thank you, and your mom both for the support. I really appreciate it.
Any last thoughts?
No, I think this is really good. You've made me more curious about veterinary medicine. I'd like to, read up on it and be more familiar with it. You hear a lot about the profession, but I've not learned a lot about it, and I would
Mhm.
like to learn more about it. So I'm going to. Um, and yeah, and I think one of like the big takeaways is just, life can be so fast paced nowadays. It's good to always pause and reflect every day just on how you're doing internally. You're on this earth. What is your mission here? What is your purpose? What are you hoping to do? How can you better do that and serve others? And then also like, pause to make sure in order to do that, you're doing well inside, right? And
Yeah,
sometimes that requires having difficult conversations, reaching out for help when it's scary to do so. And we should all encourage and empower each other to do that because society can make it hard
exactly.
um, to do that.
Awesome. Thank you so much.
Thank you. Thank you.